I am Subashini Furman. I go by Dr. Sue Furman, and I'm an oncologist, a radiation oncologist. I've always loved challenges, and as a crisis line volunteer in college, I realized the amazing feeling that comes from helping people in need. And to me, medicine combined both those things so beautifully. So I was inspired to go into medicine because it represented a challenge as well as gave me an opportunity to help folks in need. I think there are so very many roles that are great as a radiation oncologist, but my very favorite is that of actually an educator and an encourager of my patient. The diagnosis of cancer is such a traumatic experience for most folks that in order to encourage them to complete a course of treatment, to help them to cope, is such an important part of healing of them. So I see my role first and foremost as an educator and an encourager of that patient that I have to walk through a treatment course with. So I think I enjoy that the best. I think that my generation of doctors, we are trained at an era where medicine is no longer paternalistic. So I firmly believe that my patients can make very best decision for themselves. So my job, first and foremost, is to make absolutely sure that they understand things from first principle. So I take the role of that initial consult very seriously. And usually there for a couple of hours going over all aspects of their diagnosis and helping them understand what their diagnosis actually means and why recommendations are made such. Because when I do that, then I trust them to make the best decision for themselves. I think part of the challenge for us in Cheyenne is kind of demystifying this, maybe even among providers, that somehow radiation oncology cannot be state-of-the-art in a smaller community. And that is absolutely not true. You know, most cancers are now pretty well standardized, and in centers such as Cheyenne Regional that has invested in the very best technology, we can deliver equal, if not better, care compared to, say, Denver or a large city. And I think that is very important for not just our community, our patients, our family to understand, but even our primary providers and those that refer the patients to us to understand that we really have an excellent program here, speaking for not only radiation oncology, but for oncology. And then you should allow that patients to come speak to us. And certainly after speaking to us, if they choose to go to a tertiary center, we ourselves can even fix that up for them so much easier.